afternoon, this morning, this evening, depends on when you are reaching us. We are having a specialist physician talk to us about hepatitis. This is a very sensitive topic. There are lots of people who have hepatitis, especially hepatitis B, and there are a lot of people who are getting exploited out of ignorance and desperation. All right, so today we have a friend, a brother, a colleague, specialist physician practicing in Kolebu Teaching Hospital, Department of Medicine and Therapeutics. Please join me, especially invite over Dr. Daniel Amewonu to share with us on hepatitis. Danny, over to you.
Okay, Albert, thank you very much. Just want to be sure that my screen can be seen.
Yeah, properly. I can see.
Okay, I'll just put it in the power slide mode.
Yep. Great. It's in presentation mode and we are good to go.
All right, Albert, thank you very much for such a great opportunity to be able to share with your audience. I mean, this is a very important topic that when it's mentioned, a lot of people get confused about it. So many myths about it, and I'm very humbled to be given the opportunity to share my knowledge with your audience. And I would like to send a warm greetings to all your audience, wherever they may be, whether in Ghana, wherever you are in the world. I want to especially greet you and welcome you to this podcast. So, like has been introduced already, my name is Dr. Amewonu Daniel. I'm a physician specialist at Kolebu Teaching Hospital currently, and it's my honor to present to you this topic. Now, when I was given the topic to present, hepatitis, I told myself, this is a very huge topic. It's a very broad topic. And so I try to put the things together to make it as simple as I can. And also testing the pulse of what is happening around us. When they mention hepatitis, what do people think about? And so even though it's going to talk about hepatitis in general, I'll zoom in further to talk about hepatitis B in particular. But as the presentation goes on, wherever people have questions to ask concerning the other type of hepatitis, I'll be willing to share that with the whole audience. I would like to make this disclaimer that I'm doing this presentation.
Yes.
Can you see the slide mode?
Yes.
Okay, great. All right. So apologies for that little hitch that we have in technology. So like I was saying, this will be the outline of the presentation. We'll look at the definition of hepatitis. We'll look at the function of the hepatitis and look at some of the causes of hepatitis. Like I alluded to earlier, hepatitis is a very broad topic, but we'll try and make it as simple as possible. And then we'll zoom into hepatitis B infection, looking at the burden, the risk factors, some of the symptoms of hepatitis in general. And then, the symptoms cut across all types of hepatitis, the treatment that are available, prevention, vaccination, and then we'll look at the summary of all that we've been talking about maybe in the next 25, 30 minutes. I'll try and use simple language as much as possible so that we can all follow and understand. Now, when we say hepatitis, what do we really mean? What do we really mean? We've been hearing it. It just simply means that there is an injury to that organ in your body that we call liver. And the medical term for it is inflammation, like there's a sore in that organ. And that is what we refer to as hepatitis. And the liver is, we can locate it in your abdomen, what people will refer to as stomach. But I mean, the right term is abdomen. You can locate it in the right upper part of your abdomen, or what people will literally refer to as the stomach, even though the stomach is quite different from the abdomen. And I believe you can see my cursor, and that is where the liver is located. So before we do anything at all about the liver, zooming into the hepatitis, let's just take a cursory look at what does the liver do, right? Now, the liver is one of the key important organs that we have in our body. I mean, its functions are enormous, are a lot, and are very, very, very important. One of the things that the liver does is to remove toxins, okay, from the body. Aside the kidney, one of the organs that is involved in removing toxin from the body is the liver. And we cannot downplay that role of the liver. It also helps to remove old red blood cells, okay, from the body, so that at any point in time, there are very young, new red blood cells in your body that can carry oxygen, that can carry, yes, oxygen to all parts of the body, so that your body can function efficiently. Now, it also helps in the breakdown of substances, okay? Like when you take in alcohol, its breakdown is by the liver. Medication that we take in, it needs to be broken down so that the medicine can be getting rid of. It doesn't need to stay in the body forever. And the liver is the organ that does that function. And liver is also involved in producing a lot of chemicals in the body that the body needs to function properly, okay? It produces a lot of proteins, it produces a lot of cholesterol in the body. It produces chemicals that are in the blood that help in even the clotting. Okay, when you have an injury, for it to clot, for the blood to stop flowing, there are chemicals that needed to be produced, and it's the role of the liver to produce all these things. It is also involved in the storage of certain substances like glucose in a very special form, or the food that we eat. It gets stored in the liver in a very special form, so that during the time that you are not eating, the liver can now release this food into your blood gradually, so that you don't get hungry over time, okay? So in a nutshell, that is the role, or those are some of the functions of the liver. Now, what causes hepatitis? Like I mentioned, hepatitis is very, very broad, and I've just listed some common causes of hepatitis. By far, the commonest cause of hepatitis are viruses, okay? And there are so many viruses that can cause that. But the most common ones are what we refer to as the viral hepatitis, and they are labeled A, B, C, D, and so forth. Other viruses, even COVID, can also cause hepatitis. It's a virus. So there are so many viruses that can cause. This is just to mention a few. Alcohol, one of the notable substances that can cause hepatitis. And then we look at toxins. For toxin, I would like to mention in particular herbal medication. In as much as herbal medications may be good, they have their side effect, or they have substances in them that have not been quantified. And so these substances can cause injury to the liver. Drugs that we take, all drugs that we take in can potentially affect the liver and cause hepatitis or cause injury to the hepatitis. One of them is common paracetamol. When it is taken in overdose, can badly affect the liver and cause hepatitis. And once that is happening, the function, like I mentioned earlier on, fails. And so you are not able to do that, and your body begins to suffer. Now, autoimmune is where there are conditions where the body is actually fighting itself. Okay, there are quite a number of them. All these things can affect the liver and cause hepatitis. Well, So that is broadly what I have mentioned. Now we zoom in a little bit on hepatitis B. Usually when people say I have hepatitis, what most people mean is that I have hepatitis B, even though there are other forms of it. And it is a disease that is on the rise. Okay, WHO actually um, 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 document that it is a 10th leading cause of death globally. That is all around the world, the 10th leading cause of death. And it does this through its effect on the liver, okay, where the liver is not able to function properly and also may lead to cancer formation in the liver, okay? And so those things will lead to death. Now, in 2019, okay, the World Health estimated that close to about 300 million people were living with chronic hepatitis B infection, chronic hepatitis B infection. And almost like every year, close to about 1.5 million people get infected by this infection. And so it is important that we address it. And the alarming thing is that of all this infection, 70% of it is happening in Africa. Okay, and Ghana is not spared at all. When we come to Ghana, the adult population has about 12.3%, okay, of the population that is having hepatitis B, and this is really, really, really high. Okay, when you have a population that has about 8% or more, okay, being affected, that is referred to as epidemic, and something needs to be done about it drastically. So this is very, very serious. This is important. It is common than we think. And so we all need to know about it and tackle it appropriately. Okay, so I've gone through the burden of hepatitis B. We've talked about some of the causes of hepatitis. I would now look at this cartoon. Okay, I'll try and explain. Well, when one gets hepatitis B infection, what really happens? What are the outcomes? Okay, when someone gets hepatitis B infection, we'll talk subsequently about how one can get infection and then what are some of the risk factors. But I will, when one gets hepatitis B infection, few things happen. Most people, I don't know whether, Albert, please, can you see my cursor? Hello, Albert?
Yes.
Okay, so when you look at this diagram, this circle over here, majority of people who will get hepatitis B infection will not notice it, will not experience anything. Majority, about 65% of them, will not experience any symptom at all. And all these people will recover. Recover means that their body, their immune system is able to kick the virus out. It's able to get rid of the virus. That's the natural process. It's able to do that. However, if we take 100 people who get the infection, about 35 of them will now show symptoms. Some of these symptoms we'll talk about subsequently in this presentation. We will get symptoms, okay, about 35 of them. The good thing about it is that those who have symptoms, about 90 of them, okay, within 6 months, they will recover. That is, they'll be able to kick the virus out of their system through the body's own immunity, or sometimes helping the body's immunity or the body's fighting ability. 90% of them are able to recover. It's only about 10% of them that after 6 months of infection, the body is not able to get rid of the virus. And so then we call those people, they've gotten into the chronic state where their body and then the virus are now cohabitating. And that is 10%. And this is quite worrying, this 10%. Now, of this 10% that get to chronic, all right, majority of them will not have any symptom at all. So initially they may have symptoms and then the symptoms have resolved. Now they've gotten into the chronic state, but they are not having any symptom. Of these 10% that are chronic, as high as 90% of them will not have any symptom. The virus will just be hiding over there, multiplying, doing its own thing without the body's having any symptoms. And I mentioned the symptoms, we'll look at them subsequently. Now, the 10% of them, okay, of those that get chronic, one, they don't have symptoms, but some may tend to have symptoms. And some of these symptoms are the things that we don't want. They may lead to complication because once the virus is there, it is causing damage to the liver, which is called the hepatitis, but you are not showing symptoms, but it is causing damage. And over time, that may lead to the liver becoming like a scar tissue. When you have a sore or when you have a cut on your skin and it heals, it leaves a scar over there. The same thing may happen in the liver. And over time, the function of the liver is gone, is not able to function properly, and the body begins to suffer. Now, of those that are chronic, okay, under rare circumstances, about 2 to 6% of them may recover. Even those they say to sometimes it is way less than 2% may recover even after getting into the chronic state. So this picture we need to really understand the effect when you have hepatitis infection, what it may lead to, what are the possible outcomes of it. Then who can get hepatitis B infection? So by far, the most common way of getting it is through birth, okay, from mother to child. And this is what is common in Africa. In Ghana, it's not spread at all. The most common means is from mother to child. And so it is important that the infection is addressed in the pregnant woman very, very seriously, okay? And so during, while the woman is pregnant, the baby is in the womb, during that time, the baby can get the infection. Sometimes the baby will not get the infection through when the baby is in the womb, but during the time that baby is being delivered, okay, that is when the baby will get the infection. Sometimes the baby will skip this, will not get the infection in the womb, will not get it during delivery, but during the time of breastfeeding, right, then the baby will get the infection. Now, aside this route or this route of infection, you may also have it may be sexually transmitted through, when you're having unprotected sex, yes, you can quite have it through that. And this is the most common means of transmission in the Western world, okay, sexually. And there are other ways by which one can get the infection. That is the use of non-sterile syringes. And this is not a common thing we find, at least in Ghana. And yes, in Ghana, but where, they are reusable syringes. This is a very important way, or it's a very risky way of getting the infection. Then through blood transfusion, even though blood is clean, well, yes, you can get the infection through that. And then the use of non-sterile instruments during procedures, during tattooing, piercing, pedicure, manicure, yes, the instruments that are used, if they are not sterile, if they are not sterilized properly, then one can get the infection through that. Now, when one gets the infection, okay, through this means, what are the risk factors? What would determine whether this person will just have an acute infection, or this may lead to it becoming chronic? That is, if you get the infection, what is the probability that within 6 months your body will get rid of the virus, or the body will not be able to get rid of the virus within the 6 months? All right. Now, it is known that when you get the virus quite early in life, the risk of it moving to become chronic, it is very, very high. As opposed to when you get the infection later in life, then your body is able to get rid of the virus within 6 months. And there are some figures that have been quoted for it. That is during childbirth, if the child gets the infection whilst during delivery or pregnancy and things, there is a 95% chance that this infection will not be cleared within 6 months and therefore will move to become chronic. And that is what we all want to prevent, okay? And then between, if the infection is acquired between the ages of 1 to 5, there is a 20 to 30% chance that the body will not be able to clear it within 6 months, and therefore it will move to become chronic. And then after 5 years, when you acquire the infection, and then in adults, when you acquire the infection, the probability of the body not clearing it within 6 months is less than 5%. Okay, even if it is 1%, it is still significant. And so these are somewhat. So it is important that there are quite a number of people who will get the infection during childbirth or during delivery and may never be aware of it. They may not have any symptoms. They have the chronic infection, and so the only way is for them to get screened, and then they can detect whether they have the infection or not. Now, I mentioned what are some of the signs of hepatitis. If you have hepatitis, what will tell you that, okay, this is likely to be hepatitis? When you have this sign, it doesn't necessarily mean that you have hepatitis. It just means that you could possibly, okay, have hepatitis. And I'll just highlight a few of them. When you have nausea and vomiting, you feel like vomiting or you actually start vomiting. And then importantly, you have pain in the right side of your abdomen, okay? Pain at the right side of your upper abdomen. Yes, that could be hepatitis, or it doesn't necessarily mean, but it could suggest that, all right? Then when you're having a fever, okay, together with all these signs, there are so many things that could cause a fever. And the fever in hepatitis usually not so high. It may just be a low type of fever. Okay, you should take note of that. Then jaundice. Okay, when you get jaundice, it means it's quite advanced, not too advanced. It's getting severe, and so your eye, your palm, and then your inside your mouth may get yellow. Okay. Now, when you have jaundice, it doesn't necessarily mean that you have hepatitis. There are so many other things that could cause your eye to be yellow. And then people also say that when they ask you what condition do you have, what disease do you have, then they say, I have jaundice. Jaundice is not really a disease. It is just a symptom, or it is just a sign of a disease, all right? And then there are a few other presentations, like you may lose appetite, you may become weak, you may have joint pain, you may have diarrhea. I mean, just feeling of unwellness. Those are some of the things that you may experience. So it is not so specific, right? Now, so now that you've noticed that, okay, I have these signs, could it be hepatitis or not? Could it be hepatitis B or not? I mean, the sign that I've mentioned is not so specific to hepatitis B. It cuts across all forms of hepatitis. And so once you have these symptoms, what should I do? The first thing you need to do, and you need to do quite early, is to seek the help of a professional. Seek the help of speak to someone, speak to a doctor, speak to a nurse, speak to a pharmacist. And then once you get to the professional, they will take a detailed history, take some information from you to be able to find out whether it is hepatitis or not, what kind of hepatitis it is. It will be examined, and then some investigation will be requested, all right? Now, quite a number of investigations are key in making the diagnosis of hepatitis. And in this case, I'm focusing on hepatitis B. Okay, there are other forms of hepatitis, so I'm focusing on hepatitis B. So many other investigations will be done, but the basic ones that will be requested, they'll request for your blood levels to find out whether there's any infection going on. Okay, they'll look at something called a platelet level, right? They'll do a test to find out what is the function of your liver, because I said that hepatitis affects the function of the liver. Okay, it's an inflammation of the liver, so it affects its function. So we need to find out what is the functioning of the liver. So that is done through the liver function test. Then obviously, once you're having those symptoms, it doesn't mean that you have hepatitis B. Tests need to be done, and that is hepatitis B screening. Okay, that needs to be done. After that is done, then we request for one test called the hepatitis B profile. Now, hepatitis B profile is a very, very important test, right? That helps the clinician to be able to decide that the stage of the hepatitis B that you are in, because there are stages of the hepatitis B. And this staging is very important because it informs whether treatment should be initiated immediately or treatment should be deferred to a later date. Okay. Now, one of the tests that is done to is hepatitis B viral load. We need to quantify how much of the virus is in the blood, because the higher the virus load in the blood, the more dangerous it is. And so we need to know how much of it is there, and then one can institute appropriate measure. Then abdominal scan of the abdomen will be done to look at the liver to find out whether there are complications setting in or whether there are other problems with the liver. Okay, other tests that will be done include HIV, hepatitis C. Okay, these are very two key other tests that are not directly linked, but it informs how the patient should be treated. And then liver biopsy, I'll not go into details of that. Now, these are for those who have symptoms. There are people who don't have symptoms, but you just want to go and test to find out whether you are having hepatitis B or not. So a screening test can be done for those who don't have symptoms at all. And then once it is detected, when you have it, further investigation will be done to find out whether treatment should be initiated immediately or should be deferred. And if you don't have it, then you will be advised to possibly take vaccination. Okay. Now, treatment for hepatitis B. Once the condition has been confirmed that you have hepatitis B, one needs to decide, is this an acute hepatitis B infection or it is chronic? And to determine whether it is chronic or acute, I've mentioned earlier on, the cutoff is 6 months. From the time you had an infection to 6 months, if it doesn't clear, then it is chronic. But if it's able to clear within that period, then it is acute one. But most people, like I pointed out earlier, would recover. Okay, about up to as high as 90% of cases will recover spontaneously within the 6 months. And few cases where they may have the infection going on in the acute phase, usually you may just do, there's no specific treatment for people who have very bad injury within the 6 months. They are just supportive treatment that are given to the patient, and with those supportive treatment together with the patient's own immunity, okay, or ability to fight infection, you're able to kick the virus out. And then for chronic infection need treatment and then follow up. I'm stressing on the follow up. Follow up is so crucial, very, very important in chronic hepatitis B infection. If you can't do a proper follow up, then there's no need even starting the treatment. Now, when you decide to treat somebody with chronic hepatitis B infection, what are the aims? What are we looking out for? Mind you, it is not everyone who has chronic hepatitis B infection that need immediate treatment. But when you decide that you are going to treat, what are the aims? One, we are looking at able to suppress the virus from reproducing, okay, to prevent it from multiplying, because I mentioned the larger the number of virus particles in your blood, the worse it is. So you don't want that. So you want to suppress it as much as possible. Now, the second aim is that you want the liver to recover. You want the liver to be able to perform its function and not get compromised so that the body can also function. And then the third thing is you want to prevent complication. You want to prevent cancer from setting, you want to prevent the liver from losing its function. Okay, so those are the aims of treating somebody with hepatitis B infection. Who needs treatment? Okay, so re-emphasizing again, not everyone will need treatment immediately. Some people will have their treatment deferred to a later date. Not everyone requires a treatment, but however, patient will must always have a follow-up plan. It's not a one-time thing and then you leave the patient. It just has to follow up, just like you have hypertension, diabetes, and any chronic disease. You have to follow them up, okay? And then I've just mentioned some few indication, people that will need treatment immediately, okay? When it is diagnosed. They call something immune active phase. This, for the audience that I have, majority may not understand, but your clinician, your doctor will definitely understand what this means. And this, you will get it when you do, I mentioned the hepatitis B profile. 2, you're doing your liver function test, and all this help to determine whether you are in the immune active phase. Once you are there, treatment needs to be started for you. And then the number 2 case is that even if you are not in the immune active phase, but you have a lot of scar that has been detected on the that has been detected in the liver, either by a scan or a specialized scan or doing a liver biopsy. Once you have a lot of scar in there, irrespective of whether you are in the immune active, such patients should be started on treatment as soon as possible. Now, pregnant women in the 3rd trimester who has a very high viral load, that is, there are a lot of viral particles in the blood. And here, WHO codes 200,000 units, okay? When you do the viral load, they are able to state that. And so you will be able to, once you get something above this in the 3rd trimester, it is necessary that you start the pregnant woman on guideline recommended treatment, okay? Then when somebody has hepatitis B and HIV infections together, such a person needs to be treated. Or you have hepatitis B and then hepatitis D co-infection, okay? You have B and D infection together, such a person needs to be treated. Or a person who has, they've just done the hepatitis B screening, okay, and then this person has an organ transplant, let's say a kidney transplant or a heart transplant, but the person has hepatitis, surface antigen that has been done is positive, such a person needs to be started on treatment. So these are just but few indication for people who need early initiation of treatment, okay? Now, when you start the treatment for hepatitis B, what is the duration? How long would this person have to be on treatment? Okay, now treatment is lifelong, most of the time, lifelong. There are few the clinician may decide, or few situations where the clinician may decide to pause or to hold on the medication because of certain parameters, because of certain indications. And then once that is done, the patient needs to be observed. The patient needs to be followed up. If you can't do a proper follow-up, then there is no need stopping the medication. I'll mention that again. It is lifelong, okay? It is lifelong, which means you take it for probably the rest of your life, but case by case basis, the clinician or the doctor may look at certain parameters and hold on the medication or pause the medication. However, when the medication is paused, you need to be followed up because it can recur, things can change, for which medication has to be restarted. Okay, all right. Now, once you are on this lifelong medication, there are a few other things that you need to observe. Abstain from or limit the amount of alcohol, because this alcohol is also known to injure the liver. And drugs, okay, herbal medication, unnecessary intake of paracetamol, yes, and drugs that have effect on the liver need to be stopped or limited. Okay, if you are overweight, yes, you need to lose some weight, because fat, okay, deposition in the liver can also worsen the liver function. Or somebody with diabetes or having high level of cholesterol, all those things need to be under control with medication. And that would be, I mean, you'll be told by your doctor or your healthcare professional, so that those things can be controlled whilst you are on whilst you are on medication, appropriate medication for the treatment of the hepatitis B. Now, the question that a lot of people have asked is hepatitis B curable? Is hepatitis B curable? Now, with the cartoon that I showed earlier, with people who are in the chronic stage, under rare condition or circumstances, may have they may be able to kick the virus out of their system, out of their system. And that happened in less than 2% of the cases. Okay, 2% of people who are chronic, it's less. Even when that happens, one needs to be followed up, because the virus can revive itself. Okay, can reactivate itself, can start multiplying again, even though you've kicked it, but it leaves some particles within the body that the body is able to reorganize itself and then come back again. So to a large extent, I'll say that most of the time it is not curable, but few cases you may have it cleared from the system, but follow up is very necessary, because then the virus, if you don't do that, the virus can reactivate itself, can come back again and cause more problems. Okay, all right. Now, after you've had the treatment, after you've done the follow-up, okay, what are some of the things that you can do, or people who don't have the infection, what are some of the things that they can do to prevent others from getting it? Now, avoidance of high-risk behavior, such as sharing of sharp objects, the safe sexual practice, that is the use of barrier methods like the use of condom, okay, is protective. I mean, from exchange of body fluid during the sexual interaction. Now, I mentioned that in Africa, and for that matter, Ghana, the most common form of transmission is from mother to child. And so it is important that all pregnant women need to be screened. And once the pregnant woman is screened, the pregnant woman needs to be followed up. And when the pregnant woman meets the criteria or meets the criteria to be treated, the pregnant woman is put on treatment, okay? And there are things that can be done for the child that is born to a pregnant woman who is positive. I think I've mentioned the fourth point already. So in the third trimester or in the latter part of pregnancy, if it is noticed that the viral load, viral particle is so high, then this woman needs to be put on treatment. The reasoning is that it has been found that if the viral load is that high, the chance of transferring it to the baby is high. And so you want to reduce that as much as possible. Okay. Now, for people who are on dialysis, okay, they are hepatitis B negative, it is advisable that you do the vaccination for them as soon as possible. This is because of the multiple injection that they will be having, the blood transfusion that they'll be having. Okay, so they need to be put on vaccination. They need to be vaccinated as soon as possible. Then the general public, if you are found to be hepatitis B negative, you don't have it, it is very necessary, it is very prudent for you to have the vaccination done as soon as possible, because you don't know when you will be exposed to it by through whichever means. Okay, for adults, you need about 3 doses, right? That spans for a period of 6 months, and that is supposed to give you a lifelong protection. However, along the line, you may check some parameters in your body, which we call the antibody titer. And if it's below a certain level, you may take what we call a booster. Okay, but it is not automatic that everybody will take a booster. Usually, the 3 doses should be able to offer you a lifelong protection. Now, I mentioned that there's vaccination for children as well. And in Ghana, we are privileged, or we are, it's good that our expanded program on immunization actually has hepatitis B inculcated, okay, into it. And I think for the past 12 years or so, that has been going on, usually given at 6 weeks, 10 weeks, and then 14 weeks, okay? But for an infant, for a baby that is born to a mother that is positive for the hepatitis B, the immunization needs to start immediately at birth. Once the child is born, the child needs to be given the hepatitis B vaccination. And this is done together with or without another agent that is called hepatitis B immunoglobulin. And this immunoglobulin needs to be given within 72 hours after the child is born. But the hepatitis B vaccination, as soon as the baby is born, it should be given. And this is more practical. That is, hepatitis B vaccination is having the immunoglobulin. The reasoning is that the B immunoglobulin is quite expensive, and so not everyone is able to afford it. But the vaccination, yes, virtually free, and so every baby should be able to get that once you are born to hepatitis B positive mother. All right. Okay, so that brings us to the end of the presentation, but I'll just summarize it again. For 25, 30 minutes or so, we've been talking about hepatitis in general. We talked about it as inflammation of the liver, and may manifest itself in several ways. You may just feel unwell, just have some body pain and fever. You may have abdominal pain, and may have yellowing of the eye. Even though these are not very specific, they are suggestive. Okay, and then there are several causes of hepatitis, of which viral hepatitis are common. We went a bit on to look at hepatitis B infection, where we said majority of people with hepatitis B infection will recover, okay, will kick the virus out. However, we have about 5 to 10% who may progress to become chronic. And these chronic people may progress to have complications like cancer and then liver failure, which we don't want. All right. Now, there is screening for hepatitis B. There is treatment for hepatitis B, which is usually lifelong. And importantly, patients need follow-up. Follow-up is very important. Okay, vaccination is available for children and for adults as well. And so, in a nutshell, that's what we've been talking about. And I want to thank Albert. I want to thank the audience for their time in listening. I will pause here for any questions or any concern, and I'll be able to address that. Thank you very much.
Thank you
Albert,
very
please
much,
over to you.
Daniel. Thank you very much. We appreciate the lecture. It was very, very extensive. We learned a lot. At this point, if anybody has any questions, please feel free, put in the chat box, either on YouTube or on Zoom. Feel free, put in the chat box, and Dr. Amewonu will answer your questions. We have a few minutes to do the questions and answers time. If you have any questions to ask, any clarifications, he made everything very easy to understand such that we might not have too many questions to ask him. But if you have any questions, any concerns, please put in the chat box or in the comment section, and I'll read it out to Dr. Amewonu to handle for us. Dr. Amon, let me kickstart with my own. You mentioned about I like the how you approach the is it curable, because most of the people who find out that they are Hep B positive, their main concern is looking for cure, and that is how come some of them may get exploited. Um, I like what you said. Sometimes your system can clear it, and some percentage of people will need a lifelong treatment. So if somebody asks you, is it curable? What will be your one-line answer to them?
To a large extent, no.
Okay, all right.
To a large extent, no.
Okay, okay. Now, in your presentation, I kept hearing you talk about immunity, immunity, immunity. What would you say the human immunity has or contributes to hepatitis infection?
Okay, so when we talk about immunity, it just simply means the police in your system. Just like in day-to-day activity, people that protect us from bad guys, okay, the military, the police, we have the same thing in our body that protect us from bad guys, which are like germs that enter the body. They are not supposed to be there. And so once they enter, they need to be kicked out. If somebody enters your house who is not supposed to be there, you as the man, you as the father of the heart, you need to stand up and kick that person out. If you don't, the person will overpower you and take whatever that belongs to you. And it's the same thing that is in the body, okay? And that is what we refer to as the immunity, all right? And once a child is born, once somebody is born, it takes time for you to develop the necessary skills, the necessary gymnastics, okay, to be able to stand obstacles that may come your way. I mean, there are different obstacles that may come your way. It is not, they say monkeys play by sizes, isn't it?
Yes.
So you cannot, if you are small, you may not be able to conquer every monkey that come your way. And so you may have to take time to develop that skill. And so that is how come children, for instance, their immunity, we normally say that it's low. But once you are growing, your immunity gets stronger and better. Okay, so it is this immunity, it is this policing system in the body that is able to get rid of the viruses that are in the body. That is how come within 6 months, sometimes the immunity is able to get rid of the viruses. But in some cases, it is unable to do that within 6 months. And therefore, a thief has entered your house, has overpowered you, and now sitting in the house that I'm not going. Whatever you are doing, I'm also taking part in it. So that person become chronic. Okay, but over time, that if the immune system develop the necessary skills or develop a plan B, then they are able to kick that virus out of the system, even though it rarely happens. But yes, it can happen. And the once you are there are so many agents, so many things in the system that can help boost your immune system. All right. Now, when you take those things and it boosts your immune system, yes, it can help in getting rid of these viruses. Even though this supplement or this boosters have not been studied widely, there are packets of evidence that shows that yes, if we use them, it can they are helpful. However, because large scale studies have not been done, they have not been recommended widely in the use of hepatitis in general. However, there are people who use them because of the basic understanding of boosting your immune system. And once you strengthen your immune system, the ability to get rid of the bad guys, the virus in your system is very high.
All right. Thank you very much. Before I come back to that, you also spoke against herbal preparations. A lot of people get sold certain herbal preparations that are not approved by FDA, all in the quest to cure, in quotes, their hepatitis. What do you have to say to that again? I know you said it once, but just for those who join us late.
Well, you see, the game, the game of, or the main, the in this profession, what we thrive on is that what is the evidence? Okay, that is the question. Herbal medication, I wouldn't say that they are totally bad. They may do whatever they want to do. But like I mentioned, they may contain toxins that have not been documented, all right? And these toxins may rather have further effect on the liver, may further damage the liver. We can't tell, we can't guarantee that. Okay, somebody may promise you. Let me give an example of when we had COVID. So many things were used, so many medications were used, and people claimed that they were working. But when they were subject to evidence, when they were subject to analysis, they realized that no, those things people claim were working were really not working. And it's the same thing. People may claim that herbal medications, yes, are working. If somebody says that they found a herbal medication that is able to cure and get rid of the virus in the system, I wouldn't say that is not possible, but it's possible. But I'll caution people that once you have it, herbal medication more or less contain more toxins that can further worsen your liver function or the hepatitis. Even though you may have hepatitis B, I mentioned drug toxins, yes, which may further worsen the liver function. And so I would advise against it.
All right,
But you do that with caution.
All right, there's a question in the chat box which says, please, can you throw more light on the insect bite as a means of getting the infection?
Okay, so that you realize that even though it was stated over there, it is very negligible. Very, 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 very negligible. Yes, there have been packets of incidences that have been documented. And I try to bring things that are possible. If, for example, you have an open wound and sore that you have one person being infected, okay? And two people are having a wound, one person being infected, and you have an insect hopping from one person who has the infection to another who has a sore, the possibility of transmitting the fluid to that other wound is very likely. And so, that is very possible. But let me quickly add that, yes, I'm sure the person may be thinking about, what about mosquito bites? Taking it from somebody who has hepatitis B and then biting another person, it has not been documented to transmit that. If likewise for HIV, it's not been documented that those bites can transmit it, even though there have been packets of other insect bite and then insect hopping from one wound to other, which may transmit it, that have been documented, but it is very negligible.
All right. Now, the person is also wanting to know, is it possible for the 65% of those subclinical patients to enter into the asymptomatic area?
Asymptomatic career. I'm not sure what the person, but let me try and address it. So I'm saying that if you have about 100 people, okay, 100 people who, and then they all get the infection, there is about 65% who will not show any symptom at all, who will not show anything at all. And we are saying that all those people will recover. 100% they will recover. Now, if you get the infection and you show symptom, okay, that is the acute phase. Of the acute, you may have about 90% of them within 6 months, you'll recover, you'll be fine. It is just about 10% of the cases where those who are showing symptoms now become, they are not showing symptoms again. However, they've not been able to clear the virus too from their system. So the virus is living in their system, but they are not showing symptoms. Okay, I don't know whether I've been able to make that clear for the one who asked the question.
All right, okay. If anybody has any more questions, please feel free to put it in the chat box or in the comment section, and Dr. Amewonu will gladly answer your questions. If you have any question, put it in the chat box or the comment section, and Dr. Amewonu. If those of us who are joining us late, don't worry, the recording will be made available on the YouTube channel. If you're on Zoom and you've not subscribed to the channel yet, please, you can click on the link that I just posted in the comment section and you subscribe, put the notification button on so that anytime we go live, you can always be notified and you can always watch all the recorded versions of this Weekend Health Talk, as well as share with friends to also get the same knowledge. The aim is to reach more people with this accurate medical knowledge from the experts so that you know what it is that you have to know for our own life, because prevention is always better than cure. There's another question from a colleague. Please, can anyone with chronic hepatitis be cured? I joined late, so pardon me if it was addressed. Okay, all
Okay,
right.
so I'll just mention it again. I'm saying to a large extent, I will say no. Okay, to a large extent, I'll say no. However, there's about less than 2% of people who are in chronic where they get cured. But from the beginning of the treatment, the aim is not to say cure. Once you do that as your aim from the beginning, you may get frustrated. You may give up along the line. So that is not the aim at all in any of the guidelines. Nobody would ask you to aim for cure. But I've mentioned the three things: reduce the amount of virus that is in the blood, make sure you restore the function of the liver so that it can function well, and then prevent the complication. And all this is by the medication. If along that line, you are able to get cure in quotes, okay, where the certain parameters that are done is showing that it's now negative, then we can say that that is cure. Or having a surface antigen, which is initially positive, but now negative, we can technically say that is cure. However, I'm saying that once you get the person out of medication, okay, over 2-3 years, it's been found out that such people can have reactivation because the virus leaves some particles behind. Okay, can have reactivation and the person now start multiplying, the virus start multiplying in the system again, and that could be dangerous. And so largely, no. A few cases, yes.
So there's another question. Do previously vaccinated people need a booster after 10 years? And at what age does a child get screened and vaccinated against Hep B?
Okay, so thank you very much for the question. It used to be said that at 10 years, one need to take the booster, but WHO recommends that there's no need for a booster, okay? It's lifelong. However, if you want to check whether your immunity is up to scratch, you can go to the lab after taking your full vaccination, that is the 3 doses. You can go to the lab and then let them do a test for you, what we call the hepatitis B surface, and it's a hepatitis B antibody. If the value is more than 10 million international units per mil, then I mean there's no need for a booster. But if it's less than 10, then yes, booster is recommended. So I wouldn't say 10 years necessarily you need to take a booster. And then at the age where vaccinate for a child, when can the person be screened for hepatitis? And when can the person be vaccinated? Like I mentioned, in Ghana, I don't know where the person is calling from or texting or messaging us from. Okay, so Ghana, I'm saying that for our expanded program on immunization, children are being vaccinated against hepatitis B infection. This is usually given at 6 weeks, 10 weeks, and then 14 weeks. And it is given as what we call the pentad, okay, which contain about 5 antibiotics, 5 vaccines in one. And so once it is given to the child, and the child is getting the vaccination for it. And I even mentioned that for even a child that is born to a mother that is hepatitis B positive, vaccination is recommended even at birth. You should give that child vaccination. And about the screening, you can screen the child at any time for the viral infection. You can screen the child. However, even though I've mentioned that there is a caveat, I think the neonatal period, I'm not sure about this one. The neonatal, whether it is necessary to do, is necessary to do the screening for the child during the neonatal period. I don't have that answer readily. But thereafter, yes, I think the child can be screened for the hepatitis B
All right.
infection.
Another question which says, which labs do the antibody tests in Accra?
Well, I can't, well, I am at Kolebu and I can say that Kolebu Labs does that. MDS Lancet should be able to do that readily.
Yeah.
I think Send Lab and then Metropolis, Send Lab, okay? And then Metropolis, they should also be able to do that easily.
All right. So it means there are labs, the big labs in Accra, Ghana.
Yes, please.
Yeah, that's what it means. Any other question? We have a few seconds to go. Any other questions? Please put in the chat box in the comment section, and Dr. Amawono will gladly respond. As you can see, this is quite a sensitive topic. A lot of people have a lot of questions to ask about it, but Dr. Amawono made it very easy to understand, so we may not have to ask so many questions. However, because of the myth that goes with hepatitis, that is why we need to get the accurate knowledge from the expert. Any other question, please feel free to put in a comment section in the chat box, and Dr. Amawono will handle. Whether on YouTube, put in the comment section, on Zoom, put in the chat box, and Dr. Amawono will help us. Yes. All right. So, Doc, my last thing. Let me share my. I'm coming. Okay. All right. So, Doc, so per what you said, I'm big on helping people boost their immunity. All right. So, and you're also good on what's the name? Accreditation, approval, and all that. So, if there are products that are approved by FDA, which are supplements, organic, and that helps in immunity. From what you said, if I could infer, it means such products can help people who have hepatitis B. True or false?
Yes, Albert, I'll say that is true, but I'll just quickly add that such supplements should not be used on their own. Like you said, they are supplements.
Yes.
And so they need to supplement standard recommended medication. So they should not be used as standalone.
So they should be used alongside the prescribed medications from the doctor. Please. So the first thing first is you go to the hospital, you are prescribed medications, and if you so wish to boost your immune system as well, you can add on organic supplements that are approved by FDA. That is coming from the expert. This first point of call is to go to the hospital, get prescribed medications. I know somebody on WhatsApp who has been prescribed tenofovir. Dr. Amawono, I'm sure you know that. So the person has been given that antiviral, and the person is adding a supplement to it. So that is what Dr. Amawono is recommending. First, go to the hospital, see the specialist, get prescribed medication. There are antivirals that will be prescribed for you to use, and then you can add on supplement that will help boost your immunity, because once you boost your immunity, it helps together with your prescribed medications to take care of the viruses. Have I communicated appropriately, Dr. Amawono?
You are perfect. Right on point.
Great. Perfect. And for me personally, one of such product that I use, that I recommend to people, is the one that is on our screen. This is FDA approved. Salgivity, a lot of people know it. It helps to boost immunity. It is not cure. No, it helps to boost immunity, so you can take it alongside your prescribed medications that the doctor has given you. This is to supplement your prescribed medications to help take care of your viruses that are in your system. All right. If anybody has any more questions, any more concerns, please feel free to put it in the chat box. Let's always know that we need to always do the right thing. If you have any medical condition, go to the hospital and do as the doctors will recommend you to do. All right, this Longevity is an organic supplement approved by FDA. It helps to boost your immune system. It's anti-inflammatory, and it helps to detoxify your systems as well. It supplements your prescribed medication. It's not a replacement. No, you take it alongside. All right, you take it alongside. I'm making that very clear because out of desperation, a lot of people want to do a lot of things. All right, shortcuts and all that. So this supplement, you add it. It's an add-on to your. It's recommended. We are against herbals that are not approved by Food and Drugs Authority or Center for Scientific Research into Plant Medicine. We want those that are approved, safe supplements in the country. All right, thank you very much. Together with everybody, I want you to especially help me say a big thank you to Dr. Amewonu for making time to share his knowledge with us like he started from the beginning. This is freely. He gave this to us free. He's not being paid to do this. He's my friend. He's my brother. He's a colleague working at Kolibu Teaching Hospital. And I know he is an expert in this field. Just like we always do, we always host here experts in the various fields to share their knowledge with us. That is what we have done today. Those of us who might not have subscribed to the YouTube channel here, feel free, share the link with your friends so they can also subscribe and always get to watch recorded versions, or when we go live, you get notified as well. Thank you very much. In the absence of any further questions, let me be sure. Let me look at. All right. In the absence of any questions, I want to say a big thank you to Dr. Daniel Amewonu again for availing himself for sharing this knowledge with us all. Thank you very much, Doc.
Thank you, Albert. Thank you, Albert. I really appreciate the opportunity and I appreciate this. I enjoyed doing this and I'm grateful.
Most welcome, most welcome, most welcome. All right. So once again, every week we host specialists in the different fields on topical medical issues to help reduce misinformation on social media. Feel free to subscribe to the YouTube channel, share with friends. If they have any medical questions, feel free watch any of the corresponding videos, ask appropriate questions in the comment section. We will respond, and let's spread the good news about accurate medical knowledge so that many more people get educated, including us all. All right. Once again, it's been a pleasing pleasure serving you all. Let's enjoy our morning, afternoon, evening, depending on when you reach us and when you connect with us. Until next time, bye.